Hello, everybody. Welcome back to another interesting episode on the podcast Behind the Scenes Health. Dr. Ron, and with me in the studio today is Dr. Ahmed Abdulkareem. Today's episode, we're talking about startup stories because I get a lot of questions every day. Can you feature startups and all of that? Well, I guess this is our first startup on the podcast. So today we're going to be talking about Prime Bridge Health, one of the health tech companies, doing amazing stuff, disrupting, healthcare in Nigeria. And we're going to pack all of that story. Thank you so much, Dr. Ahmed, for joining us on today's episode.
Yeah, thank you for having me. Please let's keep it at Ahmed. This Dr. Ahmed
Okay,
is
that's
supposed to.
fine. I mean, it's
Okay.
basic intro before,
Yeah.
we get
All right.
into the conversation.
Yeah.
So yeah, so again, I like starting from the beginning, where it all started before we get to the point of where we are at the moment. So can you tell us a bit about your journey in medicine? What actually led you or pushed you into health tech?
Journey in medicine. If I understand that correctly, that would be how I got into medicine and
Yeah.
became a doctor and then moving into edtech. For anyone familiar with the terrain in Nigeria, especially in the last maybe 10, 20 years, you realize that once you're very good in secondary school, you're condemned to doing medicine or law or engineering. So I think that was a story for me, because back in secondary school, showed a lot of potential, showed a lot of talent. Teachers and colleagues alike to be like, "Oh no, you should do medicine with this stuff and things like that." And then developed interest in it and got into med school. And while in med school, I tried to enjoy every bit of it, academics and non-academics. I was involved in quiz clubs. I was the chairman of the quiz club at a point. Before then, several other positions involved in some religious activities, research, and journals club, and a couple of other things. I think that's the memory I have mostly about medical school rather than the stuffs and the exams and the results, which I always say would come and go, and then and we finished. Here we are. Before now, while I finished medical, by the time I finished medical school, I'll probably bet that I'll be a cardiothoracic surgeon or a neurosurgeon or something, but all of that changed down there over time, So how it changed, I don't know, to be frank, just flowing with the tide, and at the point I had to decide to leave Nigeria, I think if I was in Nigeria, I'd probably have pursued any one of those, but I decided to leave Nigeria because the model of residency training was not something I want to find myself in at all. So right from 600 level internship, I knew, I'm not, this is not for me. So I'd not even bother to write primaries in any of the specialty at all. So started USMLE stop journey back in 600 level internship, and then Trump came in, denied us visa to go and register 2 years, and then clap. So I found myself in the UK, and that continued. And then I realized there's a gap. A lot of us are leaving Nigeria. A lot of us are leaving loved ones behind. And the access to healthcare is still very limited in the country. So,
Uh-huh.
why not bridge the gap? So there's a population of Nigerians out of the country, wherever they are, Australia, UK, Canada, US, or wherever they are, and then they're leaving their loved ones, usually aged people, are back at home, and these people are usually unable to get to the healthcare facility or would not, get to the healthcare facility. So let's do something that can bridge the gap. Let's have doctors, pool of doctors, and then have a technology that they could utilize to consult with patients and also get them to go to the homes of patients to deliver care to them right in at their doorstep. That was the beginning, and it was a recognition of this gap, this need, that actually led to Primebridge and started, the journey, which I believe we're going to talk how it went,
Yeah.
but that's background, basically.
So looking at your journey now, was there any point where you sort of knew you were going to get into tech, or like you say, we're
Yes.
just moving with the flow?
Well, honestly, from Mexico, I wouldn't say I did not see that coming. Not that. No, that's not me. I did not see that coming. I always want to, I always want to meet needs, see opportunities in everything that come, maybe, in fact, I was not the type that was going to have a private hospital, because when I finished med school, my mom was going to be like, oh, come on, let's get the land, let's be something. That's not me. I want to train, I want to be a specialist and things like that. It was upon getting here, seeing what technology could do, even within the NHS, how it also reading news and see how things go. And then that was when I started developing interest. And then when I got that need, when I recognized the need, and then I got my team together, started talking to some friends who eventually will become co-founders, and then that's how that started. But not that that's always I've always seen it coming. No.
Okay, that's interesting because I mean, some people sort of know from the get go that they will get there, but some people don't. I mean, myself, I never knew I'll be in this space. Like you said, I think I was going to be like a orthopedic surgeon or something, but you know, life has a way of
Actually, yeah, yeah,
changing
yeah.
these things, really. So, looking at what you do at Prime Bridge, right? So now there are a lot of health tech startups. What sort of sets you guys apart? What's unique about Prime Bridge?
Yeah, yeah, absolutely. So usually when people hear about tech startups, what comes to mind usually is telemedicine. I'll be talking to somebody from a remote place. They don't see me. They cannot even feel me. And then and you call that medicine. And then how would I actually get quality healthcare from that? A couple of concerns. And what for Primebridge, we're beyond. We're not just a telemedicine startup. We're not just consulting people online. No, that we do more than that. So that's one thing that's actually set us apart. Like I said, we do home care. Doctors go to
Yeah.
the patient at home to deliver care to them right at home. They take blood samples. They would come up with a generalized, a comprehensive health report. Apart from that, the composition of our team is another thing. We've got a mix. So one is all of us are exposed. We've gone out of the country. We have somebody in the US. We have three of us in the UK. One person in Nigeria. So we know that healthcare system can work. It is working. You
Yeah,
understand? So and you cannot give what you don't have. So
absolutely.
we're actively involved. I've worked in the emergency department. I've worked in the orthopedic department. I'm working in the GP setup. We have a partner that is a cardiologist, cardiology in training. We have somebody that's anesthesiologist who have AI, masters in AI and machine learning. So if you look at that mix, you understand. So it is a recipe for success. You understand. So and together, apart from that, the services that we deliver and the quality that we bring forth, what the standard that we hold ourselves up to. Let me give you an instance. When we first started, there was a doctor that went to deliver home care to a patient and was very unprofessional. It was demanding money, was very,
Wow.
very quirky. I mean, not demanding, he was getting money for his service from the patient, but that does never happen. We pay you. Then it was quirky, was quite fast paced, did a checkup without actually doing blood pressure, and when we got the report, the patient reported to us, we took a swift action. We just dismissed the patient. Doctor, you cannot continue to work for us because we cannot
Hmm.
compromise standard. You
Yeah.
understand? So a couple of these things is what's actually set us apart, and we believe that if we continue doing what we're doing, if we continue like this on this trajectory, we are actually got what it takes to be very successful.
Okay. So apart from this service that you mentioned, are there any other services you guys offer or are planning to offer?
Thank you very much for that question. So I'll take you through the journey and how we started and then the evolution,
Yeah.
and as to what we're doing now. So when we started, like, which was concierge service that we started with, delivering care to patient at home and largely targeting Nigerians in diaspora to be able to provide for the need of their relatives back at home in Nigeria.
Yeah.
And not only them, there are people in different parts of the country, Abuja, Port Harcourt, who have parents or other relatives in other parts that would like their health to be looked after. So we also cater for them. But we realized that the penetration was very slow. We're not getting to the target audience and stuff like that. Then we went back to the drawing board and said, look, instead of these specific people that we're targeting, why not come up with something that is for the general population? And that was when we then introduced the 10-minute consultation and 30-minute consultation.
Okay.
What that means is that anyone, you've got headache, you've got tummy pain, you have temperature, your child is vomiting, you don't know what's going on, you just need a doctor to talk to, just go on our platform, book a 10-minute consultation, and then you pay it's talking probably 5,000 naira, and you're talking to a doctor. And I would go back to what distribution, our doctors are verified. We have the link with the MDC, and we know we get their certificate. We make sure that they are
Yeah.
certified, verified doctors. You understand? So you're talking to a doctor. If you book a 30-minute consultation, you can discuss any number of cases, like any number of symptoms that you want to discuss within the time limits. You understand, and it's very, very affordable. So those are the two others. The services. That's the virtual consultation. Then we have the second opinion consultation. So for some people who they have been in the hospital, we have a patient who was diagnosed with probably heart failure, but he's been back and forth in the hospital. With the doctors, he doesn't understand because again, this is not to induct anybody, but our patient interaction in Nigeria is not the best. You understand? Patient doctor interaction is not the best. A lot of people will just be giving diagnoses. They don't even know, they don't even understand what is wrong with them. So we bridge this gap. Understand? We bridge this gap. So the guy came to us, paid for the second opinion consultation. We linked him up with the cardiologist who was able to explain in details
Yeah.
everything to him, and then he was happy. That's all he wanted. He understand, just wanted to understand better what is wrong with him. So apart from the second opinion consultation, which is the other thing that we do, we also do what we call med up. So in pharmacies now, we are setting up like a hub in different pharmacies across the country, so that if you don't know about us, you go to the pharmacy, you want to buy some medications over the counter, the pharmacy can suggest to you, well, you can talk to a doctor right here and now,
Yeah.
and then they've set them up to our doctors, and the doctors will be consulting with them. Also, recently we are planning to get into some small and medium scale enterprises like startups to provide what looks like an insurance system to them, where in which let's say you have a company now with 7 staff members, you just come to us. Since you don't have the money to for the mainstream insurance companies, we are also a startup, so you pay a very, very subsidized amount of money for your staff members, and then they will be able to access our virtual consultation at any time they need it throughout the year. You understand? And in addition to that, they would also have access to one of what is it called, checkup in the beginning of the year. So they will have a comprehensive checkup, history examination, blood test, and everything like that. And have a health report that, look, this is your health report for the year. If you have any other need going forward, then you can come to us. So that is the other thing that we're planning to do. One thing I've not mentioned is anyone, you don't have to be sick. You don't have to have any symptoms. You can just say, look, annually I want to be having a checkup.
Yeah.
You just book an appointment. So we get a doctor to come to you at home, would review everything that is wrong with, I mean, that you might have any medical question, take a blood sample and run your blood count, your liver function test, your kidney function test, your sugar level, your sugar control, your heart functions, your cholesterol levels. We check everything and we give you a health report like, okay, fine, Mr. B, this is your health report. We think from what we've done, you're in good condition. We'll see you next year. Oh, from what we've done, oh, your liver is not functioning properly, or your kidney needs to be looked at. Oh, your blood pressure is, we then keep an eye on you, and then we can give you appointments probably in 3 months, in 2 months. So you don't have to be sick for you to need our service at Prime Bridge. So we can just do, oh, all I need is annual checkup. Just subscribe to us, and annually we'll be checking it up. It doesn't have to be January. It doesn't have to be any time of the year. It's your own beginning of the year. Yeah, I think by and large these are the things that we do for now. Yeah, at Prime Bridge. Before I go, we are also partnered with government. Okay, so recently we met with the governor of Ondo State in Nigeria. What we're trying to do is, so governments can subsidize healthcare for their citizens or
Citizens. Yeah.
residents. So in the states now, if I don't want to divulge, the nitty-gritty of what is going on in Ondo State, but just as a general overview, let's say governor from Kano State call us now and say, look, come and deliver healthcare to us, to citizens of Kano. We'll have a space in Kano State, and residents of Kano can call in at any time to discuss whatever, and the doctors will be speaking their local language. You understand? The doctor will be speaking their local language, and we would then set that up. They will discuss whatever they have. If they need to go to the hospital, you need to go to the hospital immediately. If we need to send them prescription, we send them prescription immediately, and we need to reassure them whatever what you have told us is nothing to worry about. Don't worry. So what we believe is that setting this up, it will reduce the pressure on the existing healthcare system. So not everybody will need to go to the primary healthcare center. Not everybody will need to go to the general hospitals, even private hospitals. So because we know that from our experience with the NHS 111, about 60 to 70% of things that people need to discuss, they don't need to get to the hospital to get them resolved. A lot of them can be through prescription or through reassurance. So that's the other thing. So, and we're open to governments in any states. It's not limited to any part of the country.
Wow, that's quite a bouquet of services you guys are offering. Probably explore that in detail now. So
Thank you.
there's this popular is it saying that Nigerian healthcare does not obey any law, So, and building a company, especially a health tech company, comes with its own challenges. So, looking at your journey so far, what are like the some of the biggest challenges you faced trying to build Prime Bay?
Yeah, thank you very much. So the point is, for challenges, it's true. The issue with the Nigerian healthcare system is that this is an evolving space. The edtech,
Yep.
a lot of people are very very traditional. When we had a meeting with some governments in the past, somebody practically was telling us that there is no way that you cannot operate somebody through telephone. You cannot. How will you say that you are doing telemedicine? That telemedicine cannot do everything. It cannot replace a human being. And we just have to explain. Look, we're not replacing human being. This is augmenting the service for
Yeah.
efficiency, for improved service delivery. And you would see the resistance, especially from the older generation. The buy-in is not there yet. They're still holding back, as if they will lose a part of them to these services. And there is also, because I told you, improved efficiency, reduce
Yeah.
patient workload in the hospital. So some people still believe that if the number of people coming to the hospital reduces, then the money that comes to them reduce, and they will just put all necessary roadblock to that. You understand? So, and you will need to understand that Nigerian landscape is a completely different landscape. You're coming from a sane environment where things work, where everybody obey laws and things like that. You're talking your free mind, and people are looking at you like, what exactly are you saying? You want to reduce our. So that's one. The other thing is that the regulatory framework is highly evolving. The government is trying to catch up, but they're not catching up yet. Because
Mhm.
it's not well defined, to be frank with you. So a lot of people are still just freestyling, winging it, and then just using existing law that is for the general population, for the
Yeah.
general care. That's the hospital, the traditional healthcare delivery to
Yeah.
run it. So, but nowadays, a lot of things are coming up, and I believe that in the next few years, the regulatory framework is going to be more robust. Then also is limited funding and investment. So the Nigerian space, so it's what government is interested in, or even the investors, private enterprise, that they're interested, that they're going to fund. When they don't see the political will, people don't usually will not want to put their money in that space.
Absolutely.
So that's then another thing is even the infrastructure. Ordinarily, if you are consulting a patient, and in here now, by via telemedicine, you want to refer them to a primary health care center, you just send the record, to them directly, and there's a linkage. But that's not existing. If infrastructure is very, very limited, and power supply, internet service is poor. If you want to have a proper telemedicine suit, the internet that you would need is you're likely to get to subscribe. And a lot of people who have invested in having telemedicine suits, they revert back to using Google Meets, WhatsApp, and other basic, communication channels to actually consult with patients, because the internet cannot support it. Then power supply, although we're through solar system now, we're able to probably subvert that. There's limited digital literacy as well. So that's another thing. A lot of people, even health professionals, patients and health professionals, they have limited experience with digital technologies and buy-in as well. So it's a lot of challenges, but it's not all gloomy, to be frank with you. It's not gloomy. So yeah, there is a bright side to it.
That's a bit reassuring. So looking at the funding side of things, which I know is really a very big challenge. I'm not downplaying the other issues really. So how are you navigating that funding issue? Because I know think a lot of people look for grants or look for support of VC funds and here and there. But again, on the other side, you hear that VC funds are drying up, stuff like that. So how do you fund your startup?
Thank you very much. That is, if my co-founders and members of the team are here, they're gonna sigh like, oh, there we go again. Because funding is like our major headache. And to be frank with you, since inception, it's been out of pocket. Let's put that out there. It's been out of pocket contributions among the co-founders and other and
Yeah.
some board and the board executives. That's how we've been funding now. But alternative that we've explored is largely grants. We applied for a number of grants, but which have not been forthcoming. We've not been able to receive any, and largely because a lot of them require you to be in service for at least a year, to already be in
In business.
service, in business, yeah. So a lot of them require that, and it's highly competitive. Again, you're competing against people not just Nigerians, but from other part of Africa and other part of the world. So that's about grants, but there's grants that are opening, and again, grants is a lot of work. You need to put a lot of work into applying, into
Grant
getting a
writing.
very good writing a good grant application. So we have a guy specialized in that. That is his own expertise. So is to look out for grants and then apply for grants. So that's aim. And you talked about VC, so and other investors. So we need to be very careful and in this very early stage, because especially if you have not broken even, people, if you take your business to people, they can request for 50%, request for 60% of the stake, and things like that. So oftentimes when we have this conversation amongst ourselves, a lot of the consensus is usually, let's hold on, don't let us go out. Especially our finance guys, they are always advising against approaching VCs and potential investors at this point, so that we should continue to grind and bootstrap until we have something to show for it, and then we can then brag. We have something to brag about, and we will not be coming from the position of disadvantage. So yeah. So but that's it. Other usually you would have expected, some government soft loan, and grants, for healthcare startup, because what we're trying to do, we believe in the hand, it's going to benefit massively the Nigerian healthcare system. You
Yeah.
understand? Because if you follow the drift, we're trying to eradicate the barriers to access to healthcare system. We want people to be able to access it on the phone. You don't even have to have internet. All you need to do is have the mobile number, have the number of this people, and just of our center, and call, and you're discussing with a doctor. You understand? So, and I believe over time, the buy-in is going to improve, and then we would be where we want to be, and for the betterment of the people and the healthcare system.
Yeah. Anyway, it's not the sprint; it's a marathon. So,
Absolutely, absolutely, it is indeed.
so looking at your journey so far, what would you say has been like your biggest learning experience as a founder running a health tech?
Well, it's a steep learning curve. Let's start from there. It's a very, very steep learning curve, to be frank with you, because start from forming your team. You understand? Forming the team, you have to be able to look beyond yourself, beyond and consider the dream that you have. You understand? And actually actualizing it, so to be able to gather people that have the expertise that you need, and be able to offer them what will make them to commit to the dream. In a sense, you need to be able to share the vision with them, and be able to make them buy into the vision. So forming the team was the primary, was a major step for me. To be able to call those guys, and then after the three of us co-founders, then we start again. What is the skill set that is missing among us, and how do we fill that in? We don't have money to employ, now anyone now full time. Then we then have to look at, okay, I had to source out, go through people's LinkedIn profile and recommendations, call some friends. Can you recommend some finance guy for me or something like that? And then get the person into the team. Had several meetings to offer counter offers and things like that, to be able to get this lady into our team. And another, there's other guy. There was, again, we employed a secretary at the point, and we were just paying salary. We're not making what we're paying them. We just have to let go, and things like that. We have to let go. So, and we now have to be doing the job ourselves. We have to be rotating. So it
Yeah.
means when I go to work in the morning, I come back, even when I work, when I'm on break, I need to quickly look at Prime Beach email. Is there any booking and things like that? So it's a lot of commitment and dedication. And talking about commitment, every week we have to meet,
Wow.
as a team, every weekend on Sunday. What doesn't matter what life is throwing at you, you meet, and discuss what, even if we don't have anything new to discuss, we review our process, we review what we're doing, what can we do differently, and things like that. And since beginning of starting Prime Beach, I must have read up to 10 different books about, being a good CEO, watched a lot of videos, read finance books. That's out of my space. I
Yeah.
need to understand what's going on, stocks, things like that. It's a steep learning curve, to be frank with you. So, what's my role? How do I keep inspiring the team? How do I make sure that this vision, this is going to dwindle, the passion, the aspiration, the zeal is going to dwindle, amongst people. But for you, as a CEO, you can't afford to.
Drive
If
them.
you, yeah, you have to always keep them. So it has been a very, very student and a lot of things to take away. And I'm not who I was, a year ago before I started Primebridge. And I'm grateful for that, to be frank with you, because multitasking, managing time management, people management, and conflict resolution, name it. It's been, and then even the tech, I'm not the CTO, we have a different CTO, but I need to understand what's going on in that space. And that's out of my depth, so it's throw you into the ocean and just swim without prior knowledge of how to swim. That's what it is like.
This leads me neatly into the next question. So, looking at your clinical side, well, interestingly, you're still in the clinical space and still building this side by side, sort of. So, what transferable skills will you say has sort of helped you from the clinical side to be able to sort of excel on this side?
Well, thank you very much for that question. So the thing is, as a doctor, we are capable of more than we know we're capable of. You understand? So
Mhm.
we've been grounded. Actually, I mean, doctor from anywhere, but I'm aware of doctors from Nigeria. What we've gone through. The grinding, the process that we've been through. So we within us the potential that we have that we keep beyond imagination. You understand? It's just a matter of tapping into it. When you're thrown into that situation, you would be able to, because the resilience, the ability to be able to go to work and come back to sit down on your laptop and look at something. That's back to med school when you have to wait for some 7, 8, 9 hours, preparing for in courses. You
Don't
know,
remind me of those days.
exactly. You can imagine. And those things are in the muscle memory, the brain memory. It's there because it's ability. Not everybody can, actually be able to do that. Also, leadership. It is inbuilt in us. Into one way or the other, you'll be put in position of leadership. Even when you go for 500 level outside posting, or what do you do? You might be in a place where you are leading a small team. Immediately in NYSC, you are automatically probably the leader of the NYSC clinic. And a couple of other roles. So that leadership skills comes in and when you want to lead a team, build a team, and resolve conflicts and other things like that. Definitely, your clinical skills also, who to refer, who to, if you sometimes I have to take patients, so if we don't have any doctor to, if the doctor is, if some patients are booking and we don't have any doctor available, I have to take them, so, and it doesn't matter which specialty. So because of my background, so I'm able to do that as well. So yeah, quite a number of transferable skills by and large, largely from the leadership perspective, from the resilience, consistency, ability to persevere, ability to manage yourself and time. Yeah, I believe there are quite a number of things that's advantage that you get being a doctor.
So, in terms of, let's say, things like around problem solving, things around figuring out next steps, would you say your clinical background has sort of influenced, your approach towards issues like that?
Yes, I will speak for myself because, it might not be able to generalize this. Like I said, in the beginning, I was involved in quite a number of things, in medical school,
Yeah.
from PRO to deputy secretary to vice president to president of the quiz club, then research and journals club. I was the MSSN academic chairman. A couple of things, that was going on. Class rep at that time as well, from 200 level to 600 level, 300 level to 600 level. So I came from the funnels of leadership. You understand? So usually, so it comes naturally eventually, and then you get to improve, you get better, over time. So yes, but I believe that an average doctor who has gone through the system that is designed in Nigeria as it was, you sometimes if you do 4 exams on a seat, you understand that in 400 level. God. So I believe yes, these things go a long way in actually preparing you for things that beyond what you can actually imagine. Yes, problem solving, ability to resolve conflicts, ability to lead team. Yes, I think yes, background in medicine with the way
Mhm.
we're trained actually contribute.
You mentioned earlier on that you had to read a lot of finance books, because you had to understand what was actually going on. So apart from those books you read, are there any maybe courses, certifications, or training that you sort of, maybe underwent to help you like get a better grasp of, running a business?
Yes, absolutely. So leadership and management in health from the University of Washington,
Okay.
Yes, I did that fundamentals of group health research with them as well. I also registered with a mentor. There's a lady here who is the CEO herself. I registered, did some 2 months with her, to understand, study her and understand how things are done. She also has a booming business for herself, so did that in addition to reading book, listening to podcasts, watching several YouTube videos, among others. Yes. I mean, like I said, you have to. It's a very steep learning curve. You have things that you would not imagine that you'd be able to do. Yes, you will do them because it's like a baby. When we launched Prime Bridge, for people that are familiar with my social media posts, said we give birth to. I've just given birth to another baby, and you just look, you just carry the baby. You don't want the baby to die. So that's where the business is, because it preoccupies your mind, it preoccupies your thoughts. It's first thing you think about when you wake up. It's about the last thing you think about before you go to bed. How do we scale? How do we improve this? And how do we get this? How do we get to the people? Why are we not reaching out to our target audience? That's another thing on its own. So books I read on reaching target audience, actually making sure that your product is acceptable. That this is one that I'm currently going through. It's called Hooked. So it's talking about getting people hooked to your service or your product and things like
Interesting.
that. It's just right there, because I had to stop because this is fasting period, and my schedule is usually very tight during fasting period. So again, it is a curve.
That's interesting because I don't think a lot of people actually know the amount of what would I call what word I the amount of work that actually goes behind the scenes to sort of set up these businesses, make sure they run properly, figure out how to scale, before you even talk about breaking even.
Okay, understand. So, but honest, but having said that, I think I know more in 1 year of starting than I ever emphasized. If I have not started this, I'm waiting for the right time to get this certification, get this thing going. I mean, I've had leadership and management in health from Washington for since 2018, 2019. But beyond that, I think it's about starting. If you are interested in actually having a business or starting something, there's never going to be a perfect time. There's never going to be, oh, look, this is the stars aligning. Boom, start, and then you will scale. That's never gonna happen. That's never gonna happen. So just start, and you would know what you need. You know that you are if you are true to yourself, you know you are deficient here, and you will find a way to bridge that gap. Learning and relearning. You make mistakes, you get yourself back, and things like that. You lose money, you gain money.
So, what advice would you give to any sort of doctor or healthcare professional who is trying to get into tech?
Well, I'm not the best person to advise you about tech.
I mean, you've got some experience anyway,
Ron
so
here is is a techie, so go to him and go to get. The first thing is, it might sound cliche, but do it afraid.
Mhm.
Do it afraid. A lot of us are too skeptical of the unknown, and then afraid of losing the comforts that we have at the moment, and then nothing is going to happen in that comfort zone. You need to move to the growth zone. You need, and then before you can scale. So in fact, from comfort zone to learning zone before you get to growth zone. You understand? So you need to be able to take the leap and go get a mentor, get people who have done it, get directly contact them. For people that are willing, a lot of people will be willing. If more people are willing to share their knowledge than you would envisage. Out of fear, you might not want to contact people, but from what I've learned, a lot of people are usually willing to lend a hand, tell you what to do, what not to do. And it's better to have people like that to tell you what to avoid so that you don't make their mistakes. Deep yourself into learning what you want to do, but there's not much of learning that can prepare you for what's coming. So just start, just start, and then you will see how to apply the learning. You identify the gap and you fill them. So, but yes, we need more people to definitely delve into this space. I'm still a newbie. I'm still learning a lot. If I have my way, I'll probably take some courses. From the basic courses. Go to university to study more. And all. But again, that is never going to be a break. So that's never going to stop you from starting. That's what I've learned.
Yeah. So another thing I'm curious about is around how you're able to sort of manage time. I mean, you have so many commitments really, and sometimes it feels like 24 hours is not enough anymore. So how do you manage to squeeze everything in and still get things done?
Yeah. Well, so the thing is, people that know me from med school, there's a common saying that I have. I think I can attribute that quote to myself. Our priorities are different, and that
Yeah.
makes the difference. You need to set your priority right. You need to say what is important to you, right? And you would be surprised how much you can do in 24 hours. You understand? If we sometimes when I'm deliberate, you monitor how much most of these phones now have timer to be able to, for you to know how much time you're spending on social
Maybe
media
not social media, yeah.
and some other things, So you realize how much you spent on WhatsApp, responding to chat that you cannot even remember what the content it was, how much time you spent on YouTube, X, formerly Twitter, Facebook. And usually when you don't have a plan, it's easy to fall into this trap,
All of this,
all of
yeah.
these things. But once there's a plan, once you know that this nobody else is gonna do this, you understand? No, I mean this is not gonna do that itself. I have to do that. And so and there's a common saying, eat the frog. When you wake up in the morning, eat the frog. The things that you think you find difficult to do that you're hesitant to do, just eat it. That get it out of the way first, and you realize you have a lot of time to yourself for the rest of the day. I thought this was going to take the entire day. Having said that, sometimes I get off track, because you just realize that you're not just in the mood or in the space to do these things. You lose a
Yeah.
day or two, but you just pick yourself back. You just pick yourself back, and then off you go again. You get the momentum for another 1, 2, 3 weeks, and then fall off. Pick yourself back. So I mean, I think that's how it's done. It's about priority. Set your priority right. Always outline what you need to do, what needs to be done, what is important, to you. What's important, because what is important is two different things. Is it important to you or important to other people? You understand? So you need to get it that right. Is it urgent? Is it not urgent? A lot of things are urgent and not important, or not urgent, not important. So you need to be able to distinguish the to-dos into these boxes. There's a common box about time management like that. You know,
Yeah.
is it urgent? Is it not urgent? Is it important? Is it not important? It's to woo again. A lot of people would call you. You never had a background conversation. Can you please do this for me? To be. If you don't have anything doing, then you fall into the trap of doing other people's bidding. You understand? But if you have things to do, you need to be able to say no politely. I'm sorry, I cannot do that at the moment. Maybe tomorrow, if it's not too late for you. But prioritize yourself, man. You understand? So and do what you need to do. Of course, sometimes you go out of your way for other people when you see that they are in their needs and yours
Yeah.
can wait. But that is it's not being selfish, but you just need to set a priority right.
Anyway, you first, others later.
Yeah, well,
Somebody told me that
as selfish
anyway.
as that might sound, if there's a common saying, you are the table. You understand? You are the table that every other thing is resting on. The moment you're no longer there, everything fall on the floor. You understand? So you need to make sure that you prioritize yourself. You get your heart right. And then when we talk, as we're talking about you now, body, mind, and soul should always be taken care of. You understand? So how much of exercise do you do, how much of sleep do you get, how much of diet do you eat, how much of meditation do you rest properly, do you have fun, good time with your family, all these things are what will keep you going. You will burn out, you will lose your mind, if you keep working, you keep doing these things without actually recharging the body, mind, and soul. So I like to have this in when we're talking about you and prioritizing yourself, because if you keep going out of your way, there will be a time when you can't even do anything for yourself and for others.
Yeah. Thanks for that. So as we sort of wrap up now, so how can people sort of support what you guys do at Prime Bridge or sort of If they wanted to get involved in what you're doing, how do we go about that?
Absolutely. So before I talk about how you can support us, I mean, some people might be curious about, oh, this guy's just been talking. You've started this 1 year. What's the success story? What have you done?
Yeah.
What have you exactly done? So to know whether it's something I want to join, I want to support or not. In 1 year of operation, I've been able to reach, at least we've been able to directly treat about hundreds people, thereabout, and
Okay.
then among them home service, among them virtual consultation. We have success stories. So I'll narrate two different ones. One is a woman in, I think, Ondo or Ogun State. His son is here in the UK, booked an appointment for us to go home. So we went history examination. We took blood sample to the lab, returned the blood return. We generate our health reports and sent it to the man. The woman, we called the woman to explain, oh, everything's fine, but we changed some of our medication. When she gave her feedback, excuse me, when she gave her feedback, she said she could not believe Yoruba she really was survive war in Nigeria. Like she was saying, so we have this kind of
Type
top
of
notch
stuff.
healthcare in Nigeria. She couldn't believe it, and she did not step out of her house. It blew her mind, So it was like a one in a lifetime experience for her. Like, so I did not even step out of my house. The doctor has come to me, did everything, took my blood sample and things like that, and that's the success. That's the story that we have heard from a lot of people that we deliver this home care to. You understand?
Yeah.
Because it's just ease, and it is convenient, it is quality. You can be assured of that. Also, virtual consultation for people who are skeptical about virtual consultation, whether or not they should adopt it or not, whether or not they could actually have their concerns dealt with over the phone. How can a doctor see me over the phone? That's for some people ask that question. You can go to our page, Prime Health, either Instagram or Facebook. We have feedbacks. People would say, there was somebody I saw myself who said it felt like she was talking to a prophet. It wasn't even a video call, it was a voice call. Every concern that she had were dealt with, and she got the best of care and she was reassured. So that is it, so that's one. Apart from that, we've made some partnership pharmacies across Nigeria, tens of them, hospitals, that so that if we are sick, if you're talking to somebody or we are seeing somebody and we think, oh, this person needs to be admitted or seen in the hospital, we refer them immediately to the hospital. Pharmacies, we can send your prescription to the pharmacy. The pharmacy can also send your medication home. So there is a partnership we signed with Pharma Run. So if somebody needs medication now, we send the prescription to Pharma Run. Pharma Run delivers it to you at home. So even if it's a virtual consultation, you don't want to go and pick the medicine at home.
They bring it to you.
It can be brought to you. We've made connections with different other laboratories as well. We have across Nigeria up to 15, 20 laboratories already, and government agencies like I've talked. On those states, Kwara states, we're in talk process in talking process with this. That's just about last month, to try to see how we can take this to large scale on the government level. So yes, this can work. This is working, and we're making significant progress. Within a short time. How can you come? How can you be of help? Doctors can easily sign up. If you are interested as a doctor, you want, especially if you're in Nigeria or wherever you are, and you have Nigeria, and you have a practicing license, a valid practicing license to practice in Nigeria.
Yeah.
If you reach out to us, we can onboard you on and then verify your qualification or certificates. And whenever we have patients that need your expertise or that need a virtual consultation, we contact you so that you can deliver service. And you don't have to leave your home if it's virtual. If you go to a patient house, it's extra income. You do this out of your in addition to your normal job. So
Oh,
we have a lot
yeah.
of people who are resident doctors who do this. So some people make up to 100,000 in some months. In addition, in excess. From what they get from us. So
Absolutely.
that is one. We are also in process of actually starting the physiotherapy service, so physiotherapists can also get in touch with us, so that we deliver home physiotherapy as well. That's the second thing. Governments across Nigeria, we're making progress with Ondo and Kwara, but across Nigeria, government that wants to deliver accessible quality care to their people, we will set up in the states, and then we'll deliver. People can call in to that center in addition, so that they would reduce, in fact, people don't have to waste money to take transport to and fro. They don't have to go and queue in the hospital. They don't, if especially if they don't need it. Only people that need to be in the hospital will go to the hospital. Over the long time, we are looking into get starting ambulance service. In different parts of the country, funding is a major problem. So if you have people who, I'm aware Nigerians have money. If you have people who have money, if you have money and you want to put it in a place you can trust that it will work. We are ready. My team and I are ready to go to do the footwork, to get into Nigeria and to make this work, so get us how much the money is, and we have investments, we have ideas that could run up to hundreds of thousands of dollars, and yes, and you can reach out to us to talk, and we will take it up from there, and we'll see what we can do together. So I think these are some of the things that people can do for us, and largely, majority of people, most importantly, actually, equally important, not most important, equally important is help us spread the message, help us tell people, tell someone to tell someone. You understand? There are
Yeah.
people that needs this service. We are ready to provide the service, and you will not regret it.
That's interesting. So how can we get to you? Is it through LinkedIn? I think you mentioned Instagram.
So Prime Earth Solutions has LinkedIn page, we have a Instagram page, Facebook page, and even Twitter page. So we have all the four pages, and our email is going to be probably in the comments box and on
Yeah,
YouTube.
put it in the comment
Yeah, we'll
section.
put our email there and websites, so, and it's easy to book a service. Just go to our website, book a service. You don't need to subscribe. You don't need to get any of your details, to sign up for now. It's still our first iteration. So yeah, quite easy to get across to us.
All right. If you're watching, you've heard it from the founder himself, everything about Prime Bridge, what the journey is, and how you can get involved. So I'm gonna put all the details in the description area of the channel. I'm gonna put all of that there. So if you're interested, please get across to them. So as we wrap up, any final words for those who are watching, doctors who might be watching, scare professionals who are watching?
Yeah, well, I think we have diverse group of people with different needs. But if you are thinking of starting a business in the healthcare industry, whether you are in Nigeria or out of the country, please start. You understand? Please start. You might not always win. You might not always be successful, but you will not regret starting. You're going to learn, and then something is so, and that is the most important thing. I know we all want to be successful. We all want to break even. We all want to scale, but if you don't try, you will never find out. You would never find out. So please start. If you're a patient or patient relative, or you think you have someone that might need this service, do it, and you can be reassured that we hold quality as a Bible. Quality healthcare is our watchword. We don't compromise it. And convenience as well. Wherever you are, we come to you. Either over the phone or physically. So that's it. If a doctor, you think, should I give this a try? Give us a shot. Send us an email, and then we'll sign you up if we have anybody either for virtual consultation or physical consultation. If it's within your locality, then we'll contact you to deliver the care, trusting you to deliver quality care. And if you're an investor or somebody who have interest in putting your money where you think it's gonna be useful. One, this is healthcare. We're going to deliver quality healthcare to people, so that is something that's going to change people's life. Two is a business that's scalable. It's going to give you that's going to give you return on your investment. So get across to us as well, and let us talk business.
Thank you so much. I mean, it's been very, enlightening myself, learning a lot about what you guys do because I sort of follow you guys on social media. But I think this is the first time I'm getting it firsthand from the founder to say, oh, this is actually what we do. I think your journey has also been sort of inspiring, coming from clinics, and this up, managing and all of that. So I'll say kudos to you. And to everybody watching, I hope you guys have sort of enjoyed this episode as much as we put much effort putting it together. And don't forget to subscribe and share this with your friends, colleagues, family, so that we can keep up sharing the, good stories that we bring on this channel. And yeah, that's it for me from today's episode. Until I come your way next episode, this is bye for now.